whenever acetylcholine will act on all these receptors. So when this acetylcholine will act on all these receptors, what is going to be the actions? So let's talk about the nicotine N receptor. So whenever acetylcholine will act on nicotine N receptor, we have already covered. This receptor is involved in nicotine addiction. Now this receptor can also stimulate our memory center. This is the receptor which is also present in our memory center. So when you stimulate this receptor, our learning and memory will also increase. So nicotine N receptor is involved in nicotine addiction, and it is also required to stimulate our learning center, memory center. So whenever we people have to treat dementia, wherever we have to treat a patient who is suffering from memory loss, so this is the receptor that we stimulate, and once the receptor is stimulated, then our memory is increased and people will have a benefit out of it, right? Now next is Pranjal, this class is for INS CT and NEET PG students. This class is for INS CT and NEET PG students. PG students. Pranjal, you are from which class? Like you are from which prof? Pranjal is from which prof? This is the question which India wants to know. Pranjal, this is a main video, yeah. This is not a. Do you think it's a revision going on? It's a main video going on. Okay, Pranjal is intern. So intern, Pranjal, this is the main video going on, the main class, the main regular batch class. It's not a revision video, right? इतना डिटेल में तो रिवीजन में नहीं, रिवीजन में तो अभी तक हाफ फार्मा हो गया होता. हाँ प्रांजल, रिवीजन में तो अभी तक हाफ यू हैव बाय थैंक गॉड यू हैव जस्ट जॉइंड, अदरवाइज तो हाफ फार्मा हो गया होता रिवीजन में अभी तक. यू शुड बी केयरफुल इफ यू आर गोइंग प्लानिंग फॉर रिवीजन वीडियो. This is a regular batch class, so you have not missed much. You have not missed much, Pranjal. You have come on time. Don't worry. You will catch up easily. We have just discussing the physiology part, physiology of parasympathetic system, physiology of cholinergic system. Okay, so let's guys, let's come back to our discussion. Acetylcholine will act on nicotine N receptor, and by acting on nicotine N receptor, this is the receptor that is involved in nicotine addiction as well as involved in learning and memory. Now, acetylcholine will act on nicotine M receptor that we have already covered. This is the receptor. This is the receptor which is present on our skeletal muscles and can result in skeletal muscle contraction. So this is a receptor that is required for skeletal muscle contraction, and this receptor has a property. Whenever we stimulate, if we overstimulate this NM receptor, if we overstimulate this NM receptor, whenever we overstimulate this NM receptor, this receptor has a property that this receptor will get insensitive. So this receptor become insensitive. We call it down regulation of receptor. So this receptor get down regulated. So receptor count will go down if we overstimulate this receptor. So whenever we overstimulate this receptor has a property that receptor get down regulated. And once the receptor get down regulated, instead of getting a muscle contraction, we will have the muscle relaxation. So we can have the muscle relaxation instead of muscle contraction whenever this receptor is overstimulated. This is what happens when I give two molecules of acetylcholine together. So when I give two molecules of acetylcholine together, I call it that two successive acetylcholine given together. Have you please concentrate on my words? Two successive acetylcholine given together. The drug name is succinylcholine. Succinylcholine is a drug. Each molecule of succinylcholine contains two molecules of acetylcholine. Succinylcholine is a drug where each molecule of succinylcholine contains two molecules of acetylcholine. So whenever we give succinylcholine to a patient, this receptor get overstimulated. And when this receptor get overstimulated, patient will have the initial excessive contraction. Patient will have the initial excessive contraction of the muscles. We call it initial fasciculation. We call it initial fasciculation, but this is immediately followed by the relaxation. This is immediately followed by the relaxation. So this type of muscle relaxation that is done by the acetylcholine, that is done by the succinylcholine when given to a patient, initial contraction followed by the relaxation. This is known as the depolarizing muscle relaxation. So this is known as the depolarizing muscle relaxant. The drug name is succinylcholine. So succinylcholine is the only drug which will act by this unique mechanism of overstimulating the NM receptor. So this receptor has a property that receptor will stop firing after some time when you give the extra acetylcholine to the patient. So initially the receptor is overstimulated, then the receptor get downregulated. So ultimately the muscle get relaxed. Next is what will happen when the acetylcholine will act on muscarinic receptor. So when the acetylcholine will act on muscarinic receptor, you must have covered in your forensic medicine class. The effects are known as dumbbells. Effect ko we can remember with the mnemonic, that is dumbbells. So muscarinic effects we can remember with the mnemonic, that is dumbbells. Now in dumbbells, all the actions are due to muscarinic 3 receptor. So there are total 10 actions. Total 10 actions are there, and all the actions are by muscarinic 3 receptor except bradycardia. Bradycardia is something that is due to which receptor? Bradycardia is due to which receptor? Can any one of you tell me? We are going to discuss the actions of acetylcholine on muscarinic receptor. Whenever acetylcholine will act on muscarinic receptor, the actions ko total 10 actions can take place, and these 10 actions we can remember with the mnemonic dumbbells. In these dumbbells, all the actions are due to M3, but bradycardia is due to M2. Very good answer, guys. Bradycardia is due to M2. Rest of the actions are due to M3. For example, in this mnemonic or dumbbells, the D stands for diarrhea. D stands for diarrhea. D is for diarrhea. D is for increasing the peristalsis, not the periods. ये misprint है, right? So peristalsis will increase. So acetylcholine can increase the peristalsis, and by increasing the peristalsis, the diarrhea will occur. So outcome is diarrhea. Now the D also stands for dilatation of the blood vessels. D also stands for dilatation of the blood vessels, so the BP will fall. So D is for diarrhea, D is for dilatation of blood vessels, so hence the BP will fall. U stands for urination because the bladder will contract, right? So you can see intestine muscles will contract, diarrhea because of M3. Bladder muscles will contract, patient will have the urination, right? Now you people have to understand all smooth muscles are getting contracted with M3, but blood vessels are dilated. So the smooth muscles of blood vessels will be dilated, but rest of the smooth muscles of the body will contract. Now why this happens? Yes, Bhumaraj also got a same confusion. Bhumaraj ko bhi same confusion hua. Before I tell you this confusion, Bhumaraj has asked the question. So Bhumaraj, even the scientists got the same confusion कि ऐसा क्यों हुआ? And one scientist proved this thing, कि how this happens, and scientists got the Nobel Prize. So Bhumraj, you also deserve the Nobel Prize because you also have the same query which scientists had got the query around 20 years back. So approximately 25 years back, scientists got the same confusion, कि how the blood vessels get relaxed when all the smooth muscles are contracted. When all the smooth muscles are contracted by M3 receptor, how the blood vessels can be relaxed. The scientists proved this thing, scientists got the Nobel Prize, and now the Bhumraj will get the Nobel Prize. So the explanation given on the next page. So this is the explanation. Whenever acetylcholine will act on muscarinic 3 receptor, acetylcholine will act on muscarinic 3 receptor. This muscarinic 3 receptor, which is a stimulatory type of receptor. Muscarinic 3 is a stimulatory type of receptor that everybody knows. So this will stimulate one enzyme that is endothelial nitric oxide synthase enzyme, and this will form the nitric oxide. This will result in nitric oxide synthesis in our body. Guys, have you understood this point or not? कि देखो muscarinic 3 receptor, muscarinic 3 receptor is a stimulatory type of receptor. It has a main action of doing the stimulation. So what this receptor has done, this receptor has stimulated one enzyme. And which enzyme is stimulated? The answer is nitric oxide synthase enzyme. And now it will form the nitric oxide. And now the nitric oxide which is formed, this will stimulate one more enzyme later, that is known as guanyl cyclase. So this will further stimulate one more enzyme. The name of the enzyme is guanyl cyclase. Now guanyl cyclase will increase the level of cyclic GMP, and this cyclic GMP is the one that is inhibitor of myosin light chain. This is inhibitor of myosin light chain, and because of this inhibition of myosin light chain, the smooth muscles get relaxed. So this will relax the smooth muscles by inhibiting the myosin light chain, and hence the blood vessels get dilated. So this is the mechanism which is there in the blood vessel dilation. Now this point is so important that every alternate year or maybe after every 2 years they ask one question on this pathway. So this is the experiment where the scientists got the Nobel Prize in 2000 in 1997. So Nobel Prize मिला 1997 में with the discovery of nitric oxide. So here the scientist has discovered nitric oxide as a new entity. So this is very, very important. Very, very important, right? So Indrashish has problem in audio video. So guys, other people also have this problem of audio video, or audio video is fine. Venkatesh, the name of the scientist, there were total 3 scientists. One of them was Murad. Murad was the name of a scientist you wanted to know, but that question is not important. Okay, so there is no problem. So Athira wants me to repeat this pathway again. So Athira, it's your responsibility now to remember. Is not important. Okay, so total 3 scientists. One of them was Murad. Murad was the name of a scientist you wanted to know, but that question is not important. Okay, so there is no problem. So Athira wants me to repeat this pathway again. So Athira, it's your responsibility now to remember this pathway, because every year every alternate year they ask a question. So there are high chances that you will get the questions in biochemistry as well as in pharma. You can say any subject. So acetylcholine will act on muscarinic 3 receptor. Muscarinic 3 receptor is a type of stimulatory receptor. It is a type of stimulatory receptor. It is a type of stimulatory receptor. This will stimulate one enzyme. We call it a nitric oxide synthase enzyme. We call it a nitric oxide synthase enzyme. Now nitric oxide synthase enzyme will form nitric oxide. Now nitric oxide will stimulate one enzyme in the blood vessels. So this is the enzyme which is present in the smooth muscles. This is the enzyme present in the smooth muscles of the blood vessels. That is a guanyl cyclase enzyme. Guanyl cyclase will increase cyclic GMP. Now cyclic GMP will inhibit the myosin light chain, and now this will relax the smooth muscles, and hence the blood vessels get dilated. So parasympathetic system relax the smooth muscles, of the blood vessels, and now the blood vessels get dilated, the BP will fall, right? So D stands for diarrhea, D stands for dilatation of blood vessels, U stands for urination. So Manoj Kumar has updated us. It's not 1997, it's 1998. So Manoj, please check. The scientist may have done the discovery in 1997, and they may have got the prize in 1998. So I may be at the I may not be updated. So discovery 1997 में हुई थी और प्राइज शायद 1998 में मिला था, ऐसा कुछ है. Okay, no problem, but year is not important. The concept is more important. And Adhira will now remember. Adhira, I am giving you this responsibility to you. You have to remember this pathway of nitric oxide because this is very important, right? It is very important to know. So here we have the M. The M stands for meiosis with accommodation. The M stands for meiosis with accommodation. So this part you people must have covered in ophtha. So there are two muscles of the eyes. There are two muscles of the eyes which are contracted by the muscarinic receptor. One is known as the iris muscle. We call it a circular muscle. circular muscle of iris will be contracted, and we have a lens muscle. We have a muscle of the lens. We call it a ciliary muscle. So we have a lens muscle. We call it a ciliary muscle of lens. So whenever the lens muscle is contracted, whenever the lens muscle is contracted or the ciliary muscle of the lens is contracted, the lens will become more convex. The lens will become more convex, and this is required for the near vision. This is required for the near vision, and this process is known as the accommodation. This process is known as the accommodation. So accommodation is a process in which your lens curvature will change. The lens will become more convex, and this is required for the near vision. When the lens curvature is changed, this is required for the near vision, and now you can accommodate. Your small eyes will accommodate big object. So this is a big object. This is a pen, big object. Now, when this pen is coming close to my eye, when this pen is coming close to my eye, this can be accommodated on my retina. That is known as the lens muscle. Ciliary muscle will contract. The lens will become more convex. Guys, please let me tell you, lens will never become concave. So if the question is asked to you, whenever the muscle will contract, what will happen to the lens? You always have to answer, okay, lens will always become convex. Lens will never become concave in our eyes, right? Okay. Now, what will happen to the iris muscle? So if we talk about the iris muscle, now the iris muscle is like a shape of a donut. So iris muscle is like a shape of a donut. So I can see many of you are from South India. So iris muscle is in the shape of a vada, sambar vada. Iris muscle is a shape of a vada, sambar vada. And for North Indian, it is in shape of a donut, donut. So what is the common in donut and vada? What is the thing that is common in donut and vada? So I asked this question in Punjabis. I asked this question, what is common in donut and vada? And they answered, ki, sir, both are fried. So is this the common point I wanted to know here? Ki both are fried things? No, this is not the fried. This is not the thing that I wanted to know. I wanted to know, yes, they have a gap in the center. They have a hollow in the center. So there is a hollow in the center. Yes, देखा प्रत्युष ने कहा कि दोनों में carbohydrates हैं. So both have carbohydrates. Okay. So Pratyush, do you think I wanted to know किसमें carbohydrate कितना है? So they have a gap in the center. They have a hollow in the center, and this gap is known as the pupil. Shreya has said कि both are brown in color. Both are brown in color. Shreya, donut के ऊपर तो we can give a different colors ना, है ना? Which company donut you consume, Shreya? Dunkin' Donuts or Mad About Donuts? So the central gap of the iris muscle is known as the pupil. The central gap of the iris is known as the pupil, right? Now around the pupil, the muscle fibers are arranged in the shape of a circle. We call it a circular muscle of iris. We call it a circular muscles of iris, circular pupil, circular muscle of iris. Now in between the circles, we have some fibers arranged in this shape. We call it a radial muscle of iris. So we have a two types of iris muscles. We call them circular muscle of iris and the radial muscle of iris. Let me tell you, circular muscle of iris supplied by parasympathetic nerves, and the radial muscle of iris. Radial muscle of iris supplied by the sympathetic nerves. Sympathetic nerves are adrenergic and parasympathetic nerves are cholinergic. Right now we are discussing the parasympathetic nerves that will act through muscarinic 3 receptor, contract these circular muscles, and when they will contract the circle, the diameter will reduce. When the diameter will reduce, the size of the central pupil will reduce. When the size of the central pupil will reduce, this is known as the meiosis. This is known as meiosis, right? So meiosis with accommodation. So parasympathetic system can result in meiosis with accommodation. This is the outcome of this uh, parasympathetic system. Dumbbells में M stands for meiosis with accommodation. Now the B stands for bronchospasm. B stands for bradycardia. We discussed already the bradycardia is due to M2. Now the E stands for erection. Now the erection in males due to the penile vasodilation. Erection in males is due to the vasodilation in penis. Erection in males due to the vasodilation in penis. Now, this vasodilation in penis is again due to the release of nitric oxide. So, you people have to understand, Acetylcholine can release nitric oxide in all our blood vessels. Acetylcholine can release acetylcholine. Acetylcholine can release nitric oxide in all our blood vessels. And this is the most important neurotransmitter that maintain our BP, most important neurotransmitter that is required for erection in males. So erection is only possible whenever the males are relaxed, whenever the parasympathetic system is active. So when the males are relaxed, only then the parasympathetic is activated. When the males are in stress, the sympathetic is activated, and sympathetic system can cause vasoconstriction, and that will lead to erection ka loss, erectile dysfunction. So the most common cause of erectile dysfunction is a stressful life. So most common cause of erectile dysfunction is a stressful life. So guys, please remember, many of you are leading the stressful life. The many male students here leading the stressful life because of entrance exam. Again, I am emphasizing on it. Don't take stress because you will lose many things, I mean, including the metabolic pathways and all. Right? So please be careful. So penile vasodilation is due to the release of nitric oxide, right? And that will lead to erection. Now we have नो वेंकटेश नो प्रॉब्लम यार तू इतना स्ट्रेस मत लो ऐसा नहीं है आफ्टर दिस एग्जामिनेशन टाइम इज ओवर देन देन यू विल हैव लॉट ऑफ फन है ना यू विल हैव लॉट ऑफ फन यू विल फ्लाई लाइक अ रॉकेट okay anyways no problem so L stands for lacrimation, S stands for sweating, S stands for salivation. So lacrimation, sweating, salivation, all these secretions of the glands will increase, and including the acid secretion will also increase. Acid secretion will also increase. So this is the full form of dumbbells. So who takes the responsibility to remember the full form of dumbbells? Because this is very, very important. Puri pharma mein we move around this mnemonic of dumbbells. So dumbbells is very important concept, very important full form that everybody should remember. Dr. Mehul has asked a question. Please explain the cyclic AMP pathway in M2 receptor. So Mehul, I will explain the M2 receptor in detail in General Pharma. So General Pharma mein I will explain you each and every receptor in detail, how all the receptors will work. Dr. Narayanan wants to know the bronchospasm. So Narayanan, you people have to understand that our bronchioles normal tone is constricted tone. Like right now you people are relaxed, and because you people are relaxed, even I am relaxed. So right now my bronchioles and your bronchioles are narrow. So right now our normal tone of the bronchiole is constricted tone. So whenever we people come in stress, we people start running, we people start exercising, we people will start climbing the stairs of our house, then we people require more oxygen. And during stress, when we require more oxygen, our bronchioles get dilated. So the normal tone of the bronchioles will be the constricted tone. Pratish wants to know when will be the break. The break will be at 6:15 p.m. After 13 minutes, you will get a break. Dr. Varshni wants to know about the muscarinic 1. So acid secretion is due to muscarinic 1 also. So in acid secretion, two receptors are involved. Muscarinic 1 and muscarinic 3 both are involved. So secretion of acid, both receptors are involved. Muscarinic 1 and 3 both are involved. Okay, so Sharath, I think I have answered your query. Now let's talk about, okay, this is all about the physiology. Physio part is over. So any doubt you people have in physio part? If you don't have any doubt, I can move on to the drugs. Drugs that will act on our cholinergic system. So which medicines will act on cholinergic system? So we have two types of medicines. We have two types of medicines that will act on our parasympathetic system or the cholinergic system. Right? Now these medicines can be cholinergic drugs, medicines can be anticholinergic drugs. So two type of medicines that will act on our cholinergic system, cholinergic drugs and anticholinergic drugs. Now, cholinergic drugs are those medicines that will lead to dumbbells as the effect in the body. Cholinergic drugs are those medicines that will lead to dumbbells as the effect in the body. And anticholinergic drugs are those medicines that will lead to opposite to dumbbells as the effect in the body. So, cholinergic drugs are those drugs that will lead to dumbbells, and anticholinergic drugs are those medicines that will lead to opposite to dumbbells. Now, starting with the first topic, the medicines which are cholinergic drugs that will lead to dumbbells. Now, these medicines can be of two types. These medicines can be of two types. Medicines can be directly acting, medicines can be indirectly acting. So cholinergic drugs can be of two types. Medicines can be directly acting, medicines can be indirectly acting. Now the medicines which are directly acting can result in dumbbells as the effect. These medicines will directly stimulate muscarinic receptor. So why we call them directly acting? Because these medicines directly stimulate muscarinic receptor. So the medicines directly stimulate muscarinic receptor. We call them cholinergic drugs. Directly acting cholinergic drug. They directly stimulate muscarinic receptor. Now we have indirectly acting medicines. Now the medicines which are indirectly acting, they will not stimulate muscarinic receptor directly, but they are inhibitor of acetylcholine esterase enzyme. So these are the drugs which are inhibitor of acetylcholine esterase enzyme. So they inhibit acetylcholine esterase enzyme. And by inhibiting acetylcholine esterase enzyme, acetylcholine will stay in the body for long time. And when this acetylcholine will stay in the body for long time, now this acetylcholine can act on three types of receptor. Acetylcholine can act on muscarinic receptor, can result in dumbbells. It will act on nicotine M receptor, can increase the strength of skeletal muscles. This will act on nicotine N receptor, can stimulate the central nervous system centers and improve the patient memory. So indirectly acting medicines, they will allow acetylcholine not to get metabolized. Acetylcholine will stay in the body for long time. This will act on muscarinic receptor, result in dumbbells. This will act on nicotine M receptor, stimulate skeletal muscle, contract the skeletal muscle, increase the tone of the skeletal muscle. And now it will also act on nicotine M receptor, stimulate your memory center and improve the memory. So accordingly, you can easily find out if any patient suffering from dementia, I will use indirectly acting medicine. I will not use the directly acting medicine. Any patient suffer from muscle weakness. Any patient suffer from muscle weakness, like the patient is suffering from myasthenia gravis. I will use indirectly acting medicine. I will not use the directly acting medicine. If a patient wants to have dumbbells as the effect in the body, if the patient wants to have dumbbells as the effect in the body through muscarinic receptor, I prefer to use directly acting medicine because that medicine only act on muscarinic. That medicine will not lead to side effect on the other receptor. So for dumbbells effect, I prefer to use directly acting. But for other effects, I prefer to use indirectly acting medicines. Now, starting with first topic, the medicines which are known as directly acting cholinergic drugs. So the medicines which are directly acting cholinergic drugs, the first medicine is known as bithanecol. So the medicine name is bithanecol. You can find out from its name. The medicine name ends with the word col. So this medicine is a cholinergic drug. So this medicine is a cholinergic drug because this medicine name ends with the word chol. So medicine name ends with the word chol, that is a cholinergic drug. And the medicine name starts with the alphabet B. This medicine name starts with the alphabet B. So this medicine is given to stimulate the bladder. So this is the medicine which is given to stimulate the bladder. So in dumbbells, we know that the U stands for urination. So this is the drug that is used to stimulate the bladder. And when this medicine is used to stimulate the bladder, this medicine will help in urination. The medicine can help in urination. As a result of that, this is the drug of choice. This is the best medicine for the treatment of a condition where the patient will have the atonic bladder. So any patient who come to you with atonic bladder, patient is suffering from hypotonic bladder, patient is having a hypotonic bladder, atonic bladder, right? This is the best medicine to stimulate the bladder. The drug name starts with B. The drug is cholinergic. It is a best medicine for atonic bladder and hypotonic bladder. Now, guys, there are two terminologies. One is known as diuresis, one is known as urination. You people have to understand diuresis is a word that we use in relation to kidney. कि how much urine is getting synthesized. So how much urine kidney is making is diuresis. Right? Now once the urine is formed by the kidney, it is coming down to the bladder. Now we people have to pass the urine. So the act of passing urine is known as urination. So urination is an act of passing the urine. and diuresis is the word that we use when the kidney is making the urine. So in this patient of atonic bladder, kidney is normal. The patient whose bladder is inactive, his kidney is normal, his diuresis is normal, but his act of urination is not there. The bladder is not contracting. So when the kidney is making the urine is coming down to the bladder, right? So there will be more accumulation of urine in the bladder. And when there is a more accumulation of urine in the bladder, now this urine will start overflowing from the bladder cavity. The urine will start overflowing from the bladder cavity because kidney is making the urine is coming down to the bladder, accumulating in bladder. After this bladder is full, still the patient is not able to pass the urine will start overflowing from the bladder cavity. This is known as overflow incontinence. So the word that we use is known as incontinence. Now, incontinence is a word that we use when the patient urine is coming out without the intention of the patient to pass the urine. So when the patient intention is not to pass the urine, patient does not want to pass the urine, still the urine is coming out. This is known as incontinence. And here in this case, the urine is coming out automatically after overflowing from the bladder cavity. So urine is getting overflow from the bladder cavity. So this type of incontinence is known as overflow incontinence. So here we have three names of one condition. One is atonic bladder, second is hypotonic bladder, third is a overflow incontinence. The same terminology, same condition denoted by three names. Now here in this patient, we have to stimulate the bladder and bethanechol is the drug of choice. So bethanechol is the drug of choice, and in this patient, the main complaint is the patient does not have urge to pass urine. So whenever bladder is full, we have the urge. Like whenever bladder is full, the signal will go to brain. The bladder is full. Now we will have the urge to pass urine. Urge means like in layman terms we call it the pressure. हम कहते हैं हमें प्रेशर फील हो रहा है दैट वी फील लाइक टू पास द यूरिन सो दैट प्रेशर इज नोन एज द अर्ज द टेक्निकल वर्ड वी यूज इज अर्ज सो पेशेंट को वो अर्ज इज नॉट फेल्ट सो पेशेंट डज नॉट फील दैट अर्ज टू पास द यूरिन सो अर्ज इज एब्सेंट the urine kidney is making the urine is coming down to the bladder patient is not able to pass the urine from the bladder the urine will start overflowing we call it a overflow incontinence the drug of choice is bethanechol. Now, this medicine is also drug of choice for post-operative retention of urine. So, given on the next page, this is the best medicine for post-operative retention of urine. So, after surgery, patient has a difficulty in passing the urine. After surgery, patient is having difficulty in passing the urine. The most common cause why the patient has difficulty in passing the urine after surgery, the most common cause is electrolyte imbalance. So patient will have the electrolyte imbalance and hence the nerve conduction of the patient is disturbed. So electrolyte imbalance leads to impairment of the nerve conduction. So the motor nerves are not able to work properly. When the motor nerves are not working properly, the bladder is not contracting. So this patient who has undergone surgery, this patient is NPO. So patient remain NPO for a long time and also there is a blood loss during the surgery. So there is a blood loss during the surgery. So during surgery, there is a loss of blood. Patient is NPO before surgery. So patient remain NPO. Patient does not take water. Patient does not take electrolyte, and patient will also have the blood loss during the surgery, and that will lead to electrolyte imbalance. This will lead to electrolyte imbalance, and now the nerve conduction get disturbed, and patient is not able to pass the urine. So whenever this patient is there in the post-operative room, the best treatment is we have to rectify the electrolytes. We have to treat the electrolyte imbalance. So we have to start the IV fluids. We have to start the IV fluids. The fluid of choice is Ringer lactate. So we give the Ringer lactate for 24 to 48 hours. So Ringer lactate is given for 24 to 48 hours. So Ringer lactate will take care of the electrolyte imbalance. Ringer lactate will take care of the electrolyte imbalance. This is the best treatment that we start. This is the best treatment that will start. So intravenous fluid Ringer lactate will start for 24 to 48 hours. But even after 24 to 48 hours, patient retention of urine is not relieved. Patient retention of urine is not relieved. right? Then in that case, we have to give bethanechol to the patient. So bethanechol is given to the patient in case the 24 to 48 hours fluid therapy does not work. We give bethanechol to the patient, and most of the time, 1 or 2 doses are sufficient. Most of the time, 1 or 2 doses are sufficient to relieve this problem. So bethanechol is a drug of choice that we can try in this patient. So bethanechol is our best medicine to be given. So there are two important indications of bethanechol that we have discussed. Number one, it is a best medicine for atonic bladder, best medicine for post-operative retention of urine. Now, there is a side effect of bethanechol. The side effect of bethanechol is this medicine can cause bronchospasm. So you can see even the side effect of medicine start with the same alphabet as B. So medicine side effect is bronchospasm, and because this medicine can cause bronchospasm, it's a kind of a cholinergic drug. And because of the cholinergic drug, this medicine can cause bronchospasm. So this is contraindicated. This is contraindicated in patients who are the known case of bronchial asthma and COPD. So patients who are the known case of bronchial asthma and COPD, this is contraindicated. So you can see even the contraindication starts from alphabet B. So we have a drug, bethanechol. Bethanechol is a drug that starts from alphabet B. This medicine is given to stimulate B, bladder. Medicine side effect is B, bronchospasm. Medicine contraindication is also B, bronchial asthma. So bethanechol given to stimulate bladder. Side effect is bronchospasm. Contraindication is bronchial asthma. So in patients who are the known case of bronchial asthma, so if your patient is a known case of bronchial asthma or COPD, patient is a known case of bronchial asthma and COPD, then what would be the best medicine? What would be the best medicine for post-operative retention of urine? The answer will be tamsulosin. So tamsulosin, this medicine we will cover later on. This is an alpha 1 blocker. This is an alpha 1 blocker. This is a second drug of choice for post-operative retention of urine. This is a second drug of choice for post-operative retention of urine. And overall, it's a second drug of choice. But in this case of bronchial asthma COPD, this become the drug of choice. So this become the drug of choice in bronchial asthma COPD. But otherwise, tamsulosin is a second drug of choice overall, right? So post-operative retention of urine, second drug of choice, tamsulosin, right? So this is all about this drug, bethanechol, that we have covered. In case you have any doubt, you can ask. I can see which drug is used in COPD patient? Indrashish Roy, I have given the answer of the question, right? So I have already told you bronchial asthma mein we give tamsulosin. Navjot Singh Tiwana from Punjab wants to know, can Foley catheter help? Yes, Navjot, till the time post-operative retention of urine is not relieved. Till the time this problem of retention of urine is not relieved, we keep the patient, we put the Foley's catheter, and the patient will pass the urine in the catheter only. That is why, Navjot, like if you are a doctor, you go to meet your patient in post-operative room or in the ward, you can say post-operative ward में आप मिलने जाते हो. How will you ask the patient whether he is passed the urine or not? Because patient को तो आपने Foley's लगा रखा है. So the Foley's is there, urine automatically comes out. Then how will you ask the patient whether he is able to pass urine or not? So the answer is, Navjot, these are the practical things. So instead of asking for the urine, we ask for the intestine. You people have to understand, जिनको retention of urine होगा, that person also have the paralytic ileus. His intestine is also paralyzed. So instead of asking whether the patient is able to pass the urine or not, we ask the patient whether he is able to pass the flatus or not. We ask the patient whether he is able to pass the flatus or not. And if the patient will say कि yes, he is able to pass the flatus or he has already passed the motion, 99% of time his bladder is also recovered, because bladder smooth muscles and small intestine smooth muscles have the same recovery rate. So instead of asking the history if patient is able to pass the urine or not, we ask the patient whether he is able to pass the flatus or not. Once he will say yes, then we remove the Foley's, and then we ask the patient to wait and watch whether the urine is able to come out or not. This is how we go for this. Okay, you have seen this patient and you thought it's prostatomegaly. No, it's not prostatomegaly. As a prostatomegaly hoti hai. Sunil, carbachol is also one more drug, but that is not used clinically. So we will only discuss the clinical things. So in DBMC, we always teach the clinical things which are relevant. तो ऐसे तो देर आर मेनी ड्रग्स लाइक कार्बाकोल,